Good morning, class. I'm going to go over and do a review with you for week 3. We're going to start with chapter 15, which covers preventative dentistry. So what's the goal of preventative dentistry? This is to help people of all ages attain optimum oral health throughout their lives, okay? Patient education is going to be the key throughout the time that you're working. It doesn't matter if you said it once, you're going to say it again, you're going to say it 100 times. Making sure that these patients are informed on their oral health and their dental care and what's going on with them, okay? Dental education is for a preventative program to be effective. Patient education must be reinforced and repeated over time from your notes. Make sure you know that, okay? Each patient is different and their needs are going to vary. And make sure that you're always listening to your patients because their situations are going to be completely different. A lot of people are apprehensive to go to the dentist. They are fearful to be there. They don't want to feel like they're being blamed for their oral care or the condition of their oral cavity. Just remember, we don't know everybody's situation, and not everybody has always had the finances to stay in good oral care, okay? So just being mindful of our patients whenever we're out there. Pregnancy and dental. Sorry, I clicked off my notes here. Pregnant women need to consult their dentist about different rinses, eating mints or chewing gum that contain xylitol to reduce the bacteria in their mouth that can cause dental caries over time, okay? And then making sure that good nutrition is going to be crucial for all pregnant women and their child, because malnutrition can cause physical and mental disabilities. So make sure that you know that for your test coming up. And then xylitol, we were just talking about it with pregnant women, just so that you know exactly what it is. It's a sugar alcohol sweetener that's used as a sugar substitute, okay? So baby bottle caries or baby bottle tooth decay. We know that we should never put our kids to bed or our babies to bed with a bottle in their mouth or a sippy cup. This is going to cause dental caries. It's going to cause decay. If it has water in it, it is okay. Just does not need to be milk, juice, soda, anything like that. That's going to sit on their teeth overnight because it's just going to rot them out, okay? A topical fluoride, this is what is applied directly into contact with dry teeth that are free of calculus debris and free of film. So they normally do this after you've went in, you've had your cleaning done, the hygienist has went in, scaled your teeth, she's flossed, she's polished your teeth, and at the end of it, she's going to paint the fluoride on, which will be one of your responsibilities as an assistant out there. You will get to do this, to paint the fluoride on the teeth. This is after they've been cleaned up. Okay, they got to be free from debris. And then, of course, they're going to tell you not to eat or drink anything for 30 minutes. Let that fluoride sit on those teeth for that long, okay? Sources of fluoride can be from our water, okay? The current recommendation of fluoride in drinking water is 0.7 milligrams. And then you can get it from different food and beverages, prescribed dietary supplements, some toothpastes, mouth wrenches, gels, varnishes that we paint on at the dental office, and then of course your professional fluoride that you would get at your dental office, okay? Cariogenic, what does cariogenic mean? This is food that is capable of causing dental caries, which dental caries are cavities, okay? And then, how often should we replace our toothbrushes? They should be replaced every 8 to 12 weeks. Anytime that it starts fraying or kind of the bristles start spreading apart, you need to make sure that those are replaced. And anytime after you've had a virus, like strep throat or something like that, throw that toothbrush away, get you a new one. You don't want to keep that infection going, okay? And then don't be sharing your toothbrush with your family members either, okay? Automatic toothbrushes, they're going to have a large handle, which is going to make it more useful for patients with physical disabilities to be able to use. And they're going to have also a rechargeable battery, and then the tips on them will be, you can change those over time too, okay? So just like our other toothbrushes, we're going to want to make sure that we're changing those out as well. Oral irrigation devices. Oral irrigation devices, these are going to help reduce bacteria levels at the subgingival level and also in the interproximal areas of the teeth. And then we're going to go on to chapter 16, which is going to cover nutrition. So nutrition is a science of how the body uses food to develop, grow, repair, and maintain itself. Okay? A well-nourished person is usually better able to ward off infections than somebody who is poorly nourished. Okay? There are 6 key nutrients that we need. So we have carbohydrates, we have proteins. So our carbohydrates are going to be our energy source, right? Our proteins are going to provide structure and regulate the body processes. Our fats are going to be for energy and insulation. Our vitamins are going to be for functions of our enzymes. Minerals are going to be for body structures, and the water is a forgotten nutrient. So water is very important to us. Carbohydrates are divided into 3 groups. So you got simple, complex, and dietary fiber and whole grains, which are your cereals, beans, and fruits. So make sure you know what your complex carbohydrates are. These are going to be your starches, your grains, your vegetables, your fruits. And they also supply vitamins, minerals, and fiber. So make sure you know that. Complex carbohydrates. Partially complete proteins. This is a protein that is partially complete protein, will maintain life, but will not support normal growth. Okay? So it's not a complete protein, it's just a partially complete protein. Vitamins are the best source. Primary functions, deficiency symptoms, and toxicity. Okay? So you can have too much vitamins, you can have not enough vitamins. So vitamin C is going to maintain blood vessels and capillaries. Lack of vitamin C is going to lead to swollen and inflamed gums, okay, which you will see when you're out there in the dental field. Your vitamin D is going to be for your bones and your tooth formation. That's what keeps them strong, right? Lack of vitamin D can cause poorly formed bones and teeth, okay? So you can get vitamin D by going out and sitting in the sun, soaking up your vitamin D, or from fortified milk products, or from the liver, okay? Vitamin E is important for protection of your blood cells, your body tissues, and essential fatty acids. Sorry, I'm getting tongue-tied today. Fruits and vegetables are going to supply the body with the most necessary vitamin A and C, okay? So your nuts are going to supply the body with the most fiber consumption. Water-soluble fibers can help lower your cholesterol also, okay? Different minerals, you can have calcium, phosphorus, fluoride, are all minerals that are important in the formation of your teeth and your bones, keeping them strong. Labeling ingredients. Ingredients are listed in descending order of weight to indicate the proportion of any ingredient. So whenever you're seeing how they're listed on the labels, that's how they're listed. So labeling claims. So in low-fat foods or reduced-fat foods, fat is replaced with sugars. Okay, make sure you know that for your test. The calorie count may be the same or higher than that of the original higher-fat versions of the food. And consumers need to make sure that we are reading the labels carefully, okay? They add a lot of extra stuff in there that's not always good for us, or it's not naturally occurring in our bodies or in our food that we eat, okay? Chapter 61, communication in the dental office, okay? So communication is going to come in all forms, and it's going to be the backbone of the organization, from the front office to the back office, from you to the patient, from the dentist to you, from assistant to assistant, from assistant to the lab, and so on, okay? Social attitudes. As people grow and develop in life, their social attitudes are going to begin to be influenced on their behavior and their cultural way of thinking, okay? Communication pathways are effective communication is one of the most important aspects of the DA's job. And why is that? Okay? Because we need to be able to communicate well to our patients. We need to be able to communicate well to each other to have a well-oiled machine that we're working in, okay? Every message we send has two parts that must coincide in time. So we have the statement proper, this is what I've told you, and then the explanation. My God, am I tongue-tied today? Sorry. This is how I expect you to understand it. So you should always give instruction to the patient, make sure that they know it, have them verbalize it back to you so that you know that they understand what you have told them, okay? Being a team member, what does it mean to be a good team member? You're going to show appreciation to your coworkers. You're not going to take advantage of them. Always think before you speak. Just because you thinking it in your mind doesn't mean it needs to be said. We don't want to hurt people's feelings out there. Of course, we don't want to watch anybody do anything that could injure somebody else. So there may be times where you need to step in and say things, okay? And people may get offended by that. But you always got to be thoughtful in your thinking and what you're saying out there, okay? And don't let your emotions get involved. We all know we have bad days where we come in and things may have happened at home. Don't bring it to work with you. Because you're having a bad day, don't let your emotions get the better of you. And sometimes maybe you just need to walk away and take a breath for a minute and gather together and then go back and get your job done, okay? And remember that your way is not always the right way out there, okay? Just because you do it one way doesn't mean that Susie over here is doing it the wrong way, okay? And don't get offended if somebody tries to show you another way to do things. It may be something that works a lot better and easier in the long run for you. So, again, don't wear your feelings on your sleeve, and don't be afraid to learn new things out there. We're not always perfect in everything that we do. Patients' needs, we need to make sure that we're mindful of how they are greeted, how they're treated on the phone, how they feel in office, and how effectively the staff manages their business aspects of the patient's needs, okay? We need to make sure, if it wasn't for our patients, we wouldn't have jobs. So we need to be mindful of how we're treating them. We need to treat them like we would want to be treated, like we would want our family members to be treated when they're in there, okay? Doesn't matter if that patient gets on your nerves, or they call too much. Without them, we would not have a job. So be mindful. Like I said, you can think things, can't say it, okay? And the anxiety and fear, there's going to be a lot of patients that have anxiety and fear whenever they come in to the dental office, okay? Your phone skills are going to be very important. You're going to want to make sure that basically you're smiling through the phone. You're talking to them. It doesn't matter if you're having a bad day. You switch that off. Hi, thanks for calling Dr. Such and Such's office. And, how can we help you? Okay? You're not supposed to be eating or chewing gum when you're talking on the phone. Make sure that you speak clearly and slowly. Don't talk too fast to where they can't understand what you're saying. I have a tendency to talk too fast sometimes, so I have to slow myself down sometimes. Make sure that you always get the patient's name whenever you talk to them and why they're calling. You may not be able to get right back with them. Take their name, their number, give them a call back after you've been able to go back and speak with Doc, so that you get a game plan to get that person in, depending on what the situation may be, okay? And always make sure that you address them by their name. By their proper name. Don't call them, Susie or Susie Q or Sweetie, Honey Pie, whatever, Mr., Mrs., and their last name, okay? Or if they don't want you to call them by their last name, call them Miss Susie or Mr. Henry, It's just a sign of respect. All right. If y'all have any questions about anything, please feel free to message me. We're getting close to the end of the module. We'll be ending next Thursday. So if you have any assignments or tests that need to be turned in, try to get those in as soon as possible. That way you're not ending up with an incomplete. Okay? All right. Thanks. Y'all have a great day.